My name is Dr. Ashraf Al Houffi. I'm a consultant working in the intensive care unit of Dubai Hospital. I'm a pulmonary critical care consultant, but I am also the chairman of the Infection Control Committee of Dubai Hospital. Recently, most of the healthcare workers started to understand clearly the importance of prevention and control of infection, because it became very apparent that when we are waiting for infection to happen, we may suffer a lot trying to control it and to treat it. And we realize clearly that our best option is to prevent either the acquisition of infection or the transmission of this infection from a patient or a carrier to someone else. If we do that well, then this will decrease tremendously the impact of infectious disease in clinical practice. I have a feeling that there is a very big gap between what we can say as an academic awareness and the actual practice of the healthcare workers. So most of the healthcare workers may be aware about probably all the important aspects of prevention and control of infection, but when it comes to practice, we find a lots of lapses, a lots of gaps. I'm not sure either they are busy in their daily practice or they don't give it a very high ranking when they are thinking, but I assume that with the continuous educational activities to make them very well aware about the importance of those practices, I think this will improve. And this usually have a direct impact on the level of infection rates which we see inside the hospitals, and definitely it will affect our practice. I think the biggest challenge which we are facing now is the increasing bacterial resistance. We started to see not only a super bugs, but we started to see what we can say a mighty bugs, where there is no more antibiotics which will help us to treat and eliminate. And that's why, as I said initially, here comes the importance of preventing the acquisition of this infection and cross-transmission it to someone else. Because sometimes we face this problem with bacteria which we really cannot treat, and it's on the rise. And there is no really difference between if you are looking at the same problem in America or in Europe or in the Middle East or the Far East. The whole world now is a very small village. What happens in India today will be with me probably in the same day, because we are living in a very small village. So the bacterial resistance is the major challenge which we really have to address nowadays. Yeah, this is something which is very important. Sometime before, everybody in the clinical practice thought that fungal infection usually happened to immune-compromised people, people who have low immunity. And they did not perceive the critically ill patients in the ICU as one of them. So we started to see increasing number of fatalities, and then we suddenly realized that fungal infection actually in critically ill ICU patients is probably more serious than the one we are seeing in immune compromise. So we started to have to put some protocols how to approach patients with suspected fungal infection. Now, we don't want to become hasty and unnecessarily starting antifungal therapy for everyone who is critically ill, assuming that he is what we call immune paralyzed, if we don't want to describe them as immune suppressed or immune compromised. So I will address the issue from a certain point that every patient in the intensive care unit need to be subjected to a risk assessment. And if the risk assessment will put that patient in the proper position that he is likely to have the fungal infection, we have to assess the severity of the illness. If the risk assessment will match and the severity assessment is there, then it is the time to start the treatment for the fungal infection right away. The major problem we face with fungal infection is the poor diagnostics. We don't have a very good diagnostic tool, so we are either neglecting, so we are delaying the treatment, or we are unnecessarily over and abusing the antifungals. So risk assessment model, severity assessment strategy, starting as early as possible, will be the way to deal with possible invasive fungal infection in the intensive care units. Yeah, it's a very important event. When you gather a group of specialized scientists in a field like infectious diseases from the area, the whole region, and probably from all over the world, you will have a very good exchange of ideas about what is happening. Because as I told you, the world is not that big anymore. It's just a very small village. What's happening in Europe, I can just be part of it in no time. At the same time, we can do that. Then if you get those people, exchange of ideas, and we can also talk about the way we are dealing with our problems, it is not very different. When I am talking to people who are coming from Europe, I can see very clearly that they are facing the same challenges which we are facing here. Yeah, they have different patients, maybe they have different diseases, but eventually we all come to confront the same. So getting people from different areas with different expertise and different knowledges and exchange all of that during the period of the conference is very productive, and it is very beneficial, not only for the audience and the people, delegates who are attending the conference, but even to the speakers themselves, because it's very crucial for us to know what is happening everywhere in the world. And that conference is an important step in that direction.